Good evening, everybody. SAMTRA committee would like to welcome everyone attending and our speakers and our SAMTRA community to another wonderful webinar. This evening, we will be discussing communicating health research and policy with our speakers, Ms. Liezel Engelbrecht and Dr. Lethukwenama Letsoalo. Just to notify everybody that we are recording the session, and please just to keep the mics off for now. In terms of the program, we'll have our welcoming, our housekeeping, our panelist introductions, Q&A for panelists. We'll open the floor for any additional questions from our community, and then our final remarks with a vote of thanks. In terms of housekeeping, please, if we can ask everybody that's not speaking to keep their camera off, to mute audios. We'll ask everybody to ask questions that they have in the chat, and we'll then take it for later for our panel discussion. And please note that questions will be filtered by our facilitation committee. We'll ask this later in the session, and then please feel free to use the react function when engaging with our speakers. All right, so our first speaker, Ms. Liezel Engelbrecht, is a nutrition lead at the Hold My Hand Accelerator, incubated at the DG Murray Trust. She is a registered dietitian with a background in journalism, as well as contributing across government, the NGO sector, academia, global organizations, supporting policy and research as a large-scale nutrition program. Handing over to Pindila, who will introduce our second speaker.
Thanks, Megan. We're very excited to have our second speaker with us, Dr. Lethukwenama Letsoalo. Thank you so much for joining us, Dr. Lethu. She is a medical doctor and public health specialist. She's a passionate advocate for health promotion and disease prevention. Dr. Lethu has led large-scale public health programs, community health initiatives, and behavior change campaigns reaching millions of people. And we get to be a lucky few tonight. Alongside clinical practice, she brings expertise in health education, patient counseling, and community engagement, making complex medical information accessible and actionable for diverse audiences. So welcome, Dr. Lethu. We're very happy to have you.
Thank you very much, Pins. So Liezel will be starting asking your first question. In your work, you've had to communicate nutritional evidence in ways that actually move people to act. What distinguishes research communication that is genuinely decision useful from research that stays in a journal? And what has worked for you in the South African context?
Let me unmute first. Thank you, Megan, for the nice introduction, and good evening to everybody on the webinar. It's lovely to be here tonight. So I think it's useful to start with what is research communication, and it's not just about the findings. It's about getting the research, the right people, and through the right channels. So if we think about communication or research that's in a journal, that's specifically targeted at researchers, right? So we need to think, who do we want to communicate to? So if we are speaking to policymakers and program managers and frontline workers, we'll engage with them in a different way. So we'll engage with them, for example, through policy briefs, or through presentations, or they'll be consuming other media. So research shouldn't just stay in a journal. And if we're thinking about what is decision useful research, it's really more about, it's not only about the what is the research or why is it important. It's also about how we are going to implement it and who's going to implement that. So I really need to sort of link the research. You need to translate that into what it's going to practically mean and how we're going to do that. And then we need to think, who do we want to target? So if we're thinking about an intervention, like how are we going to implement it, who's going to implement it, we need to think about what is it going to cost to implement this. Is this already something that the system can be integrated in the system? And if not, how are we going to make this work? So all these things we need to think about that might need additional pieces of research or a lot of conversation to see how this can fit in. We also need to think about what the risks are and what the constraints are. So communicating these things to make a decision useful is really about having a lot of conversations with the right people, the audiences you want to sort of share the intervention with, or share your specific sort of pathway to a specific problem. So we really need to think about not only what does the evidence say, but really how that can be implemented. So yeah. If we think about practical examples in South Africa, or what we have done, so a couple of things that Hold My Hand is working on is really linked to maternal and child nutrition. So one of the things is looking at multiple micronutrient supplementation and how that can be used in the antenatal care flow to replace iron folic acid supplementation. So we know there's a lot of global research, but now we need to think, what local evidence is required, what will it cost, how does the South African roadmap look, and then we need to start those engagement with the relevant stakeholders, not only the Department of Health, but also researchers. We need to think what enables a product to go from global evidence to something that's actually implemented. We need to think about, it needs to go onto the essentials medicines list. It needs to go into standard treatment guidelines. So there's a whole sort of, value chain of things that you need to go through and processes that you need to become aware of. And that's through conversations, to be able to, at the end, say, okay, we have this strong evidence, global evidence on this supplement that works and that's shown to be superior to reduce things like low birth weight outcomes, preterm birth, etc. But then how do we take that and how do we get that into a public health system? And then you need to think about, these things about cost. Is there a mandate for it? How will the system absorb it? So yeah, those are some of the practical advice or guidance I can give.
Thank you for clarifying, Liezel. And so important that we understand our target population, how to communicate when we're communicating, the importance of translating that data and with targeted interventions. And that really was a great example. Handing over to Mpindile.
Thanks, Megan. Thanks so much, Liezel, for that. I'll be asking the second question to Dr. Lethu. So Dr. Lethu, you create health content in isiZulu for communities in a jargon-free way. What have you learned about communicating health evidence to audiences in ways that actually land and that are understandable to them?
Thanks, Pindile. Thanks for the introduction earlier, and good evening to everyone on the webinar. So I think Liezel has laid really good groundwork in terms of being able to look at, do we have research in this area? Is this research relevant and applicable to our setting, right? Because I think it always needs to be contextualized. So now, how do we communicate research that lands? I think for me, the first thing is that people need to be able to understand what you're communicating. So like Liezel was saying, depends who is your audience, and the language that you use and how you actually present that kind of evidence needs to land. They need to be able to understand it. So when it comes to the kind of work that I do, I communicate mostly with communities, right? So it will be lay people when it comes to healthcare. It's also about them being able to see themselves in the work that I do. And how do I bridge that gap? I speak to people in a language that they understand and their own mother tongue. And this is possibly something that a lot of patients don't get to experience within our healthcare systems, let's say when it comes to like a lot of consultations, because maybe there's a language barrier between the clinician, the doctor, the OT, and the patient. So there's a lot of information that is lost there in that communication. And I think maybe something that might be a barrier that I find a lot in the work that I do is that a lot of medical terms don't exist in ways that resonate with people, or in different languages, in a lot of our South African languages that aren't as well developed when it comes to maybe clinical medicine and research as well. So there's a lot of things that you do need to make more relatable without oversimplifying, right? And then ensuring that things land means that people are actually acknowledging the information that you're sharing, and they're considering it and possibly taking a decision or action from that. So in order for that to happen, I think the most important thing there is trust. So people need to be able to trust you, right? So I think as healthcare professionals, we do have that lever of trust that we have with communities, and we need to be able to honor that and use it wisely. So online, there's a lot of information, information overload, but also lots of misinformation, right? So that's why we need credible voices that people already trust. But now, once you start communicating in a way that people understand, resonate with, you form a community, and they're able to refer to you when there are health concerns, or when there's something happening concerning healthcare, they know that there is a credible voice that they can refer to.
Thank you so much, Dr. Lethu. That was a really helpful insight, and just great to hear the importance of trying to dissolve the language barrier and find the balance between making information relatable but also not oversimplifying. And yeah, very key about the trust and the credibility that we hold as healthcare professionals. Thank you so much. I'll be handing over to Megan.
Thank you, Pins and Dr. Lethu. I agree. Highlighting what it means to bridge the gap in building trust is such a key thing as healthcare professional that we always need to be held accountable for. Liezel, your next question. DG Murray Trust's partnership with the Department of Health on the maternal support grant is a concrete example of evidence and implementation. What role do intermediaries such as DGMT play in ensuring health research is translated into effective policy?
Thanks, Megan. And perhaps just to note that the maternal support grant is interesting in that it's actually a policy that sits with the Department of Social Development, that it has a lot of impact with the Department of Health. So we are actually working mostly with the Department of Social Development on this, but it's important to think about the interdepartmental collaboration and integration of priorities. So and that's also where intermediaries can play a very important role. So the role, I think, of organizations like DGMT and Hold My Hand is really the ability, I think, to help convene and connect some of these stakeholders, and also to provide sometimes additional resources, and not only financial resources to make things happen. Because often if you're thinking about writing a new policy, it's not just about people emailing or sort of throwing around a few ideas. There's there are like a lot of processes, a lot of committees sitting, people that you have to budget time for. You're getting professionals involved. Some people are paid, some people are not paid, but it's a whole process, and that process costs money, because that is also time. And a lot of times, what intermediaries can do is to sort of help some of those convenings, help connecting those people, helping with those engagements. So I think that's a really important role. We can help act as a bridge between some of the academic institutions, some of the government officials, and also there's public also helps form a policy. So civil society organizations. So there needs to be also some demand from the public in some instances for a policy to be able to change. So yeah, I think there's an important role, and I think it has a lot to do with that we are more flexible, more agile, and can really sort of, have a sort of a role that can help sort of bring people together in a way that government perhaps can't always. And through that process, you can get more buy-in, more momentum, and that can help then push a policy through faster.
Thank you, Liezel. That was a fantastic response. I think it really highlights how important it is to have our public-private partnerships and our multi-sector collaboration. I'd like to hand over next to Pins for Dr. Lethu's next question.
Thanks, Megan, and thank you, Liezel. Dr. Lethu, your next question. So you've moved between a lot of areas: clinical practice, community health work, academic public health, and digital communication as well. So in a sense, you're also acting as an intermediary. So our question is, as you're carrying health knowledge across contexts and audiences, how do you hold the integrity of the evidence while making it accessible and relevant?
Thanks, Pendile. So I think sometimes there's a misconception that there's a trade-off that we need to make, right? So when it comes to choosing between accuracy and accessibility, so something can be both accurate and accessible, and it goes back to possibly the point that we were talking about a bit earlier right now, in terms of being able to simplify things, but in a way that still makes sense and still keeps the evidence and holds the evidence, right? And I think maybe this brings us to realizing that science doesn't answer all questions, and we need to be comfortable with that truth and being able to communicate that with patients, right? Communicating that I don't know or we don't know yet in a way that builds trust rather than leaves people confused, because then it's going to seem like, we actually don't know what we're doing, but in a way that we actually don't know the answer to this question, but these are the kind of interventions that we have at this point, right? And so for me, it's more about translating the science into something that can drive behavior change in a way that still keeps it intact, and not just this is what the science is, but also this is what the science is, and this is what you can do about it, and this is what this science may mean for you. I think with social media, it does carry a risk because people can misinterpret things. And I guess for us as healthcare professionals, there's also very fine lines between providing healthcare education, which I do, and providing medical advice, right? So you'll find that a lot of people will ask you a lot of questions that are personal to them. And it's not something that I can immediately answer, but it's something that you actually have to refer to your clinician. Like, I need a further history on this. You need to be examined. You need to be processed and investigated properly so that we actually know what the problem is. So even being able to remove yourself from the situation in terms of this is not something that you can just get a simple answer about, because it's more complex than it seems. And, you actually do need further attention. Yeah, so I'll pause there on that one.
Thank you so much, Dr. Lethu. That was a very rich response. I think there was so much wisdom to be taken from that, but also just really key for us to know that accuracy and accessibility are not in contention with each other, and with a lot of effort, we can actually make kind of combine those two together. But also just really loved what you said about the value of acknowledging our gaps in knowledge. I feel like in the healthcare space, we're happy to do that. Oh, we don't know the answer to this. But then when it comes to patients, we feel the pressure to know everything. And so I think taking what is a reality in the healthcare space and being humble and translating that for patients is very important. So thank you so much for that. I'll be handing over to Megan and Liezel for the next question.
Thank you, Pins and Dr. Lethu. I really love that you touched on patient-specific information and personalized care with evidence-based information, and also just being able to say, we don't always have the answers, we're looking for them, we'll build the trust in the community, but sometimes there's a little bit of a call for action as scientists and as healthcare professionals to be able to take the next step forward. So Liezel, your next question. The Hold My Hand Accelerator brings together government, civil society, and community organizations to improve maternal nutrition outcomes at scale. What are the most honest lessons you've learned from this initiative, and what it actually takes to make evidence-based information programs work in the South African context? Sorry, Liezel, you are muted at the moment.
Sorry. Thank you for the question. I just want to also mention that the Hold My Hand Accelerator, definitely maternal nutrition is one of our key priorities, but it is about children and the maternal nutrition being a part of the child nutrition as well. So there are 10 key priorities that the accelerator looks at, and improving nutrition for children is one of them. And then of course maternal nutrition being key to that. So some honest lessons is that I think firstly that relationships are really important. You know, in trying in any of the work that we do, but as we also work across different sectors, it's really important to build relationships. And I wanted to look up the right wording and I forgot, but there's this saying that you can only move at the speed of trust. And I can't remember who said that. But for me, that is a very important lesson, because often we want to work fast. You know, there's a lot of people that are very passionate, and you have an idea and you want to run with it. But if people are not on board and you haven't built a relationship and they don't trust you, then you're not going to go very far. They need to trust that both that you are all the parties are aligned on the same goals. They need to sort of, you know, trust that first and foremost. Then they also need to, you know, trust that you are going to not abandon them or sort of go a different direction. They need to trust that, you know, if you want to make a change, you're not going to be a good weather partner. So you need to also in that relationship also be honest with your partners about, you know, that like Lethu said in the previous response, we don't have all the answers always, and sometimes you only learn through implementation and you make mistakes, and that's also part of that trust building, and you really need that trust and that buy-in and engagement with different stakeholders to make things work. The other important thing is, and that was also touched on in the previous answer, but you need credible messengers. You need sort of people that are credible, that can sort of help you take an initiative and evidence, you know, informed program from sort of A to B. So you need, you know, people on board that are sort of that know the evidence in the academic space. You know, the leaders in the health system. You need those people to be champions. You need the leaders in the community to be champions of that idea, of that intervention, of that policy that you are championing. And then you also need political leadership. If you don't have that, then you won't get very far. You know, you first of all, you need to make sure that, you know, whatever you are proposing, that it's evidence-led, and that, of course, but that it's also, you know, there's some policy mandate for it, and you need to, you know, make sure that your goals or the goals of the intervention are aligned with what is in some of the policy mandates already, or right space, for example, in the maternal and neonatal and perinatal guidelines. You know, there's clear mention of a package of interventions for maternal nutrition, infant feeding. So, you know, that's something that you can build on. But then you also need that political leadership to say, you know, this is what we're going to do, and there needs to be accountability, because without that, people won't be held accountable, and without that, you will also won't get very far with your intervention or your policy or your proposal. And yeah, I think maybe the biggest lesson is also that implementation is often the test. You know, a good idea, you know, isn't worth much if it can't be implemented. So you know, good evidence and a good model isn't enough. You need to good delivery systems. You need good relationship. You need to have operational detail, and there's always going to be sort of, you know, things that that come up, assumptions that you've had that are not going to play out necessarily like you thought it would. So I think, yeah, what it takes to make an evidence-based informed program work is really sort of being open to these things, knowing these things upfront, and, you know, being able to adapt to change as you move along.
Thank you, Liezel. I think that honest and very insightful response gives us a few fundamentals, which include leadership, accountability, honesty, alignment, credibility, and the respect to collaborate and deliver. So again, thank you. I will hand over to Pins and Dr. Lethu.
Thanks, Megan. And yeah, thanks, Liezel. I love how essentially people-centered your response was, that it really requires buy-in at all levels. And so I think that's something to remember when we engage in all of these professional endeavors, is how much people matter and those relationships matter. So moving on to the next question for Dr. Lethu. So Dr. Lethu, in recent times, we've seen that, especially in the sexual health and reproductive health space, the scientific evidence can be clear, but the public and political environment around them is quite contested. Whether that's the content of gender and sexuality education or access to safe care. And so our question is, how do you navigate communicating evidence in such scenarios?
Yeah, so I mean, sexual and reproductive health is quite complex. It's heavily influenced by politics, by culture, and I mean, I wouldn't even be surprised looking at the maternal support grant that Liezel and her team are working on if there's actually contestation in terms of, do people actually deserve this grant? Do pregnant women deserve this? When there's actually evidence that supports that it does, you know, and it has positive outcomes, especially long-term outcomes, right? But also there's just a lot of misinformation that fuels the contestation that you talk about, right? There's a lot of misinformation around sexual and reproductive health and around women's health, and just stating, for the sake of this conversation, that sexual and reproductive health doesn't only include women's health, and I know it's usually channeled towards women's health, right? So I think it would be important for us to look at some of the levers that also play a role here, which will include mistrust in healthcare and public health, especially for Black and brown women who, when it comes to research, they're people who've usually been excluded from research and history, and then after that, further exploited by it, right? So even when, you know, the recent develops that we've seen, there's a study that was published recently by the University of the Free State regarding endocrine disrupting chemicals that are found in menstrual products. So that's something that was really disheartening for a lot of women, but also something, you know, you mentioned this earlier, that some of these I don't knows and we don't know what comes next. There's also a call for more research, and women's research is underfunded. And what does this create? It creates a vacuum and a market for a lot of industries to actually step in and take advantage of that, and sometimes prioritizing profits over women's lives when it comes to women's health, that is, right? So the contestations, I think it's important to always go back to the evidence, but going back to the evidence is also putting people first, right? Because a lot of that research, yes, it is, oh yeah, to that point of it being contextual, right? So we go back to the evidence, we look at what the evidence says, and this is the matter that we're dealing with. But if we're going to look at what's happening politically right now, we look at the US and how things have transpired regarding abortion laws in the US. I mean, we're lucky in South Africa that abortion is legal, but given that, you know, we previously received a lot of funding from the US for a lot of our sexual and reproductive health interventions, those do become concerning, right? But now we also look at our own context where abortion is legal in South Africa, but we still have a high number of backstreet and illegal abortions. And this results in a lot of maternal deaths. This results in a lot of complications that women face. So it also comes back to access. And the conflict there is obviously a lot of our religious and cultural beliefs in terms of, do I think abortion is a good thing to do? Is it right? Is it wrong? And do I have a right to put my opinion on someone else's bodies? So all of those things, I don't think they'll go away overnight. I think it's conversations that we need to keep bringing forward. You know, I posted a video about abortion, I think earlier on this year. And you can imagine the social media response when you start talking about abortion, which is expected, you know. But people also need to start being sensitized about it. I obviously have my own personal opinions about it, but also those opinions shouldn't be affecting someone else's body and the decisions that they make with their body. So, you know, being very clear as clinicians and as leading voices in healthcare about those parameters and those lines that we can and that we can't cross. I think that's very important, and it's a space that I try to hold. But there's definitely a lot of tension in that space, which is why we need to be there talking about these things and being the credible voices that support the rights of people who deserve, you know, everyone who deserves sexual and reproductive health services, and making sure that they have access to them, especially when they need them.
Thank you so much, Dr. Lethu. Yeah, I think it's just really important to understand how our history informs our present day understanding of a lot of these issues. And it's our duty and our responsibility as healthcare professionals to look into some of that misinformation, the understandable mistrust from a lot of marginalized and exploited groups, and how can we be more inclusive and reassess some of the evidence we use in this healthcare space. So thank you so much for that. I'll hand over to Meeks for the next question.
Thank you, Dr. Lethu. I think it's also, again, food for thought on the role of politics affecting health research and why timely evidence-informed decisions matter in context. All right, so this question is actually for both Liezel and Dr. Lethu. South Africa's quadruple burden of disease means that maternal and child nutrition, sexual and reproductive health, HIV and TB, and non-communicable diseases are all pressing at the same time. So Liezel, what you've written about how stunting and overweight can coexist in the same household, and Dr. Lethu, you've worked across HIV, sexual health, and primary care. How do communicators help the public hold and improve their understanding of this complexity?
Lethu, do you want to go first? Yeah, so I think, you know, we often speak about these things in silos. We speak about, you know, about HIV, and we speak about obesity and stunting and malnutrition. And I think it's helping the public connect the dots. So to help people understand, nutrition is linked to maternal anemia, and that can really influence the baby's growth outcomes. And you can have a mom in a household that's anemic and HIV positive, and the child may be stunted and obese. But also, connecting the dots, but not making it too complicated. So I think, tell the story, help people understand, make it, what are the realities that people are faced with, but also to say nutrition has an impact on how you respond to HIV medication. So it's not only about, just having nutrition to, for your child, but it's also for you. So if you do fall pregnant again, that you're also well nourished and that you're healthy and that your medication is working well. If you're speaking about food security and about obesity and stunting, it's not about the amount of food, but the type of food and the quality of food. So connecting the dots, but I think then giving the public real sort of practical advice. What can you do in your setting? Things like breastfeeding, for example. How do we support breastfeeding? So that's sort of really, very focused, something that can support child malnutrition, something that can help prevent overweight and obesity and non-communicable diseases later in life. So there's a real sort of practical entry point, or Yeah, so it's really thinking about what message do you want to share? How is that relevant to that community, and how can you make it real? How can you sort of help that that individual see that situation in their lives, but also give them the agency to feel that they can also act upon the information. So yeah, I'll stop there. Lethu, over
Yeah,
to you.
I think you've laid some good groundwork there. I love this example because South Africans are dealing with this daily, and you might not be the individual dealing with all of it at once on your own body, but in the household. So I love that example. It's a mom, she probably has HIV, child is stunted, maybe the husband has TB, and maybe there's violence in that home as well. Um, so all of these complexities are people that are things that people actually live with daily already that we know about. And I think it's important to acknowledge that. Um, Very difficult when it comes to having a 15-minute consultation and you're really trying to see the full psychosocial, biopsychosocial aspect of a patient's treatment and plan going forward. But another public health issue that we have. But I also think that what I leverage in the kind of health communication that I do on digital platforms is being able to communicate things in not in silos, but not everything communicated at the same time, because that can be overwhelming and it can be confusing, right? So what I've started doing right now is actually doing content series right now. So right now I have a series, or I think you guys may have seen if you're on social media that you even get playlists, and we have this playlist on HIV, and if you're interested in HIV, and maybe you might have diabetes as well. So where do those link up, and how does pregnancy and HIV work together? So you're trying to bring those different groupings together, because the patient could have all of those at the same time, or both of those at the same time. And now that this patient has seen 3, 4, 5 of my videos and they've decided to engage with my community, there's a bit of trust that has been built. And now maybe if I'm in this situation, then I can always go back and refer to some of the content that we've covered before that maybe wasn't so relevant for me. Maybe I was just interested in learning about this, but now I actually think I might be affected. So I think very similar to what Liezel was saying now, being able to communicate what's relevant to that person, and just maybe zooming out on our quadruple burden of disease and looking at the driving factors of these, right? So nutrition is definitely one of them, like Liezel mentioned, but also the environments, we can't, I worked in Soweto. It was very difficult for me to consult a 48-year-old woman who has hypertension, diabetes, hypercholesterolemia, they're obese, and they need to be exercising. I can't tell them to go run around the block. It's not safe. The environment doesn't allow for that, right? So this is where what you were referring to, Liezel, earlier comes in terms of multiple sectors coming together to make the environment to enable people to make better decisions about their health and their well-being. So yes, there's a lot that we can do at an individual level, but at a structural and policy and systemic level, there's a lot of decisions that need to be made to allow health to thrive at the individual level as well.
Thank you, both of you. Those were fantastic responses. I think, Liezel, you really pointed out the need to move away from the silo approach and integrative care, multi-sectorally, practically, and relevant change for the public. And Dr. Lethu, where you also highlighted it and acknowledged holistic care, tackling information, and also creating the spaces for agency where the community can actually be their own agents of change, but where we can facilitate that as well as agents of change. Handing over to Pindile.
Yeah, thanks, Megan. I think you encapsulated that well. So I'll just move on to the next question for both of the speakers again. For Dr. Lethu, so you're reaching communities with sexual and reproductive health information in isiZulu, as we spoke about, on digital platforms at a scale that clinic-based services cannot match. And Liezel, DGMT has used public campaigns and media to shift understanding of nutrition and health. And so the question is, what genuine opportunities do digital platforms offer for getting evidence-based health information to people who need it? And what are the risks, particularly around misinformation?
Sure, I can go there. So I think there's definitely a big opportunity there, and I don't think we're using it enough. It's underused and underutilized by healthcare professionals. Um, what I love and appreciate about digital platforms is that they democratize access to information. If you have a phone, you can access information, although, there are still levels of some people can access it and some people can't, but a wider audience is reached. I mean, I've been able to build a community of over 600,000 plus people across platforms. And most of my content is in isiZulu. And I've noticed the difference between when I post something in English and when I post something in isiZulu. The engagement is totally different. The response is very different, which, and that's how I built my platform. I realized that there's actually a need. People actually want this kind of information. People want to engage more. And maybe, that's why I'm calling for more healthcare professionals to be online, because there are gaps. There's an information gap that can't be reached in the short consultation times that we do have in our healthcare system, which is overburdened and understaffed. So there's a lot of information that patients don't get. Today, I was speaking to someone working in HIV about how these consultations don't allow for patients to even process their diagnosis, process their treatment plan and they follow up. And when it comes to things like HIV, even disclosure, if you really think about, if you work in the clinical space, how a patient moves through the system, oh my word, they tested that side, okay, you need to go to a clinician, get started on treatment, you need to go to the counseling team. It's literally from point to point without any pause or acknowledgement. And yes, we do have consultation services, but it's also a question of how effective are they and what is the quality of counseling that we provide to patients. And that leaves a gap. I mean, in South Africa, a shocking statistic that I found when I was doing my master's research last year, the average South African spends 3 hours, 30 minutes on social media a day. 3 hours, 30 minutes on social media a day. So why are we not talking about important things that affects people's health and their lives? So I think there's definitely a big opportunity there, right? The risks. So you asked about risks. I think the risk is obviously the misinformation, which we know is already there, and just overburdening people with information as well. Sometimes I feel like I need to take a pause and let people process what I've spoken about, and then we'll start off again, right? And we have a lot of voices that aren't qualified, that talk about healthcare, that give medical advice, and that people follow. And that's unfortunate. And unfortunately, a lot of the misinformation and maybe voices that aren't as well trained as we may be in this call, that kind of sentiment and content and information that's there online travels faster, right? It travels faster and quickly, and those platforms actually support that kind of information. And there's a lot of research that's actually going into what kind of information, and especially when it comes to healthcare, is actually propelled forward by the platforms that we use when we are on our phones for 3 hours 30 minutes a day, South Africans. So yeah, I think what would be important for me is us getting online and being visible and sharing credible information that is evidence-based by people that communities can trust, acknowledging the risk and being able to counter the misinformation, and being able to be relatable and make things make sense in the simplest way that we can, and being honest about what we don't know, because that's where we might miss people, when we can't admit what is missing. Yeah.
Thanks, Lethu. I think you said most of it, so I will just build on that, and I just want to tap on the what you said about patients often not understanding their diagnosis. I remember during my time in the hospital and at clinics, you would have to consult somebody that has diabetes, but they've been diabetic they've been diagnosed with diabetes for over 5 years, and they still don't understand how to manage their diabetes. It's because nobody took the time to really explain it to them, and it's always just a very short consultation, or they didn't realize that it's that it's not managed well, and then they end up in a hospital situation. So I definitely think there's, like you said, there's opportunity, especially if we think about the health system, the healthcare system that you mentioned. There are time constraints, resource constraints, really, staff pressure. So while the clinical consultation is still really essential, of course, in that setting, digital communication can be an extension to that. It can be much more responsive. It can be much more conversational. You can do it in different languages as you are doing it. And I think that's, that's really powerful, that we can use this platform. That's, like you said, people can choose what type of information they want to tap into, and if they don't understand what does diabetes management look like, for example, they can go to the diabetes channel and then sort of link to that. So I think same, risks are, definitely people that are not qualified, that are spreading information. But I think also healthcare professionals, we should also be careful on, about how we communicate and what we communicate, that we don't, we shouldn't lead people to believe that this is a clinical diagnosis, being made, or, this is, if they have a problem, you should always still consult with your doctor if you have an issue or concern. I think there's, with that freedom also comes great responsibility, but I don't think that should stop people from professional, educated, registered healthcare professionals to communicate, because that is important. So don't get, I think, despondent because of all the misinformation out there, because I think often, one gets so frustrated, you don't want to add to the noise. But I think it's important to remember, your voice is actually not the noise. Your voice is trying, actually potentially going to be very important to somebody that comes across it, that resonates with it. You can speak to them in a specific manner that connects with them, and you can be an extension of that sort of information that might have been missed, in that time pressured environment in the healthcare system. So, I think Lethu 100% what you said.
Thank you so much to you both for those great responses. I think, Dr. Lethu, I just loved what you shared about the importance of dismantling access gaps. If so many people are spending so many time on social media, why are we not moving the information to them? And so I think meeting people where they are is central to what we do as healthcare professionals, and digital platforms allow us to do that. And I think, Liezel, I also really loved what you shared about how that works in tandem with the consultation. Consultations are still valuable, but obviously they do have their shortcomings. And this is a great extension and another opportunity to help people understand, their health issues. And we must acknowledge the risk, but risk is not a contraindication to stepping into that. So I think that's great as well. So moving on to the next question, which I'll be handing over to myself for. Dr. Lethu, I'll ask you this question. So you've built a significant digital health communication presence, contributing to communities in South Africa. For health professionals who want to contribute beyond clinical care, whether that's research communication or advocacy, where is the leverage point? Where can they have the most impact?
Sure. It depends. It depends what you want to do, right? I am someone who's gone into digital health and communications and still work in public health, and I've chosen a lot of my focus to be around sexual and reproductive health and non-communicable diseases. Someone might choose something else. You might choose to go work in programs and implementation work. You might choose to go work in advocacy and join a lot of advocacy groups, which have played a very big role in a lot of what we see in South Africa right now, especially when it comes to probably widely known would be the Treatment Action Campaign and the work that they've done in HIV. So it's always important to also have clinical voices in those kinds of spaces. there's so much to do when it comes to public health. It's really a matter of just tapping and opening that door. I think what a lot of people in healthcare face, or like probably on the clinical end, is the discomfort of exploring possibly an uncommon path or uncharted territories, right? So I sit in a lot of discomfort in terms of what happens next for me. And I think that's also okay. You know, it's also really okay to try and explore something new and something that you think might work for you, and maybe that's where your passion lies, and see if it works. And if it doesn't, then you try the next thing, or you go back to clinical, or, you know, I think the opportunities are endless out there. And we just need to be, we need to have that thing of being curious about what's next. And if you want to take that bold step, I definitely encourage it. But also, you know, being on LinkedIn really helps. There's a big community of a lot of people doing many different things from across the world, and just not being afraid to reach out. Like, so if you know someone who's doing something that you think you might be interested in, I'd definitely say, reach out, find out what they're doing. If you want to get involved in research, then reach out to the organizations, reach out to the people who are already in that space doing that kind of research, see how you can get involved. We just shouldn't limit ourselves. And I encourage curiosity and just being able to better yourself.
Yeah, thanks, Dr. Lethu. I think that's really helpful advice. Just firstly, telling us the many ways that we can get involved. But secondly, you know, it is uncharted territory. Unfortunately, in a lot of undergraduate curricula, there isn't much on how we can be prepared for a career path that doesn't look clinical orientated or research orientated. So I think, firstly, maybe that should happen. Maybe we need to reevaluate those curricula, but also secondly, we need to be fearless about entering those spaces, reaching out to people, and being curious, as you've highlighted. So thank you so much for that insight. I'll be handing over to Megan and Liezel.
Thank you, Dr. Lethu and Liezel, again for your responses previously. Pins, you wrapped it up so well. And I think just touching again on the importance of context-specific, outcome-focused communication, and yes, even the space to network. So, Liezel, last question. What would you say to an emerging healthcare professional in South Africa who wants to do the kind of work that you're doing, which is sitting at the intersection of research, implementation, and policy? But sometimes we don't really know, like what Pin said, we don't know where to get there, how to get there. So what is the first step?
Me and this mute. Yeah, so my path was also a bit unconventional. So the first 10 years of my career, I spent in media. So I was actually a journalist and a magazine editor. And then I really fell in love with health, and I retrained as a dietitian, and then also did my master's in public health nutrition. So, you know, through that whole process, I knew I wanted to get involved somewhere in public health. But also I was a bit older, so I was a bit more sort of, focused on sort of looking at sort of what potential opportunities are. But to be honest, even if you look, sometimes, you know, you are so inexperienced, you don't even see all the opportunities. So it was great for me to have I had 2 lecturers that were mentors for me, or acted as mentors. I feel that they were mentors, and they sort of helped also introduce me into some spaces. I did a lot of work initially, just sort of, you know, sitting in on meetings, listening, joining discussions, joining webinars, without getting paid, like doing clinical work, doing consulting work where I can, but then also doing these things on the side, trying to get involved in public health campaigns with advocacy groups, and then also worked with program development, and got involved with some research. And I felt like really inadequate when I started, because I didn't feel like I really knew what I was doing, but I just was so interested in the type of work that I tried my hand at everything. Not everything, but anything that I could, that opportunity presented. So I didn't say no a lot. And so my advice would be, try to, if you want to work in this intersection, then it's good to expose yourself to the different parts of this intersection. So try and do a little bit of sort of get involved with a little bit of research work. Try and get involved with some public health campaigns. Try and get involved with some program work to really see what communities are doing on the ground. What how communication in communities look like if you speak to NGO, working in EC, early childhood development and nutrition spaces, or working in HIV care, sort of doing some of that work, or sort of getting to understand that. And then also keeping your technical skills obviously up to date, and then embracing your uniqueness. I think, as I was a bit older, and some other people, they maybe had additional years experience, but you kind of need to embrace your uniqueness. So embrace that you have sort of a bit of this background, and sort of you can bring this to the table. So don't be afraid of what you can bring to the table. Think about sort of what your interests are, what your strengths are, and what you can bring to the table. Don't compare yourself to others. Like just follow follow where your interest lies. I think that goes back to what Lethu said. Stay curious. So don't only follow what you think you are interested in, but also stay open, stay curious, and also stay humble. It's you're going to learn a lot. There's so much to know, and it's difficult to really really be an expert on all things public health or public health nutrition. So be open, be humble, be curious, but also back yourself. Like Lethu said, don't be afraid to bet on yourself, back yourself, try new things. And I think more practically, build that skill of translation. Be practical. So if you read a journal article and you think it's something important, how would you translate that into a policy brief, into evidence? Who would your target audience be? Sort of try and sort of build that muscle. Who would you speak to? How would you speak to them? Why would it be important? And just try and also see the whole chain. Don't only see one part, but really try and see where does the politics fit in? Who makes the decision? Who makes the decisions? Why do they make the decisions? Who is this important to? So try and see that chain as well, and then be open, like Lethu said, be on LinkedIn, connect with people, and before you know it, somebody might reach out to you, and you might then be involved in research, and then the rest is history.
And that last part you're mentioning, Lisa, I think it's so important. Just stay in tune with whatever opportunities are out there. So there's a lot of conferences in a lot of different research areas. There's an HIV conference coming up now in Brazil, and they were offering scholarships for students, for professionals, for people to apply and go. There's the World Health Summit is coming down to Cape Town now, coming in September. So if you have an opportunity to apply to those things, put your name out there, see how it goes, go experience it, go meet people in different industries, go network. I think those are very good opportunities to just put yourself out there. If you're still in university, I'm seeing your student number. It says 215. So I think there might be students on the call as well. I was also in Stellenbosch. So if you're a student, literally speak to your lecturers and the researchers in your university. They'll know a lot of what's going on in the industry. Can you get involved with a bit of the research that they're doing? I did a little bit of data collection when I was in medical school. In dermatology. I'm not interested in dermatology, but I did it. And, now I can say that I've done data collection. I have that on my CV in case I'm applying for something that's research adjacent, although it's not something that I'm passionate about that much, but, I gained that experience. So yeah, don't be afraid to ask. People are usually always willing to help. You just need to ask.
And maybe just a last thing, Lethu, when you said you did data collection and dermatology, I think that's so important. Like looking back, I've done so many things that I'm really not that passionate about, but I said yes and I did it. And looking back, it has served me so well, knowing those skills or just being in a room with some of those people. So it doesn't always need to be, the thing you're most passionate about, but like, what can you learn? Like if you're curious about sort of learning and the process about, it will really serve you somewhere down the line, even if you can't see the full picture now.
Thank you both so very much for, I think, your personal and unconventional responses and journeys. And I think, again, networking becomes so important. And yes, you are seeing my student number. I'm a master's student. I'm finishing up. So yeah, there are opportunities. I completely agree with you. And I think also taking the leap of faith and saying, this might not be my thing, but it could be. I think that's fantastic answer from both of you ladies. Thank you very, very much. We are going to move on to questions from our community. We're just going to wait to quickly load it. All right, so we had questions come through from our community, and this first one is for Liezel. What tends to be the biggest barrier after stakeholders are brought together? Alignment on evidence, competing incentives, or political feasibility? Sorry, Liezel, you're on mute again.
I think it can be sometimes a bit of everything. For example, just alignment on evidence. I'll use the example that Lethu also previously gave about some of the pushback still against the maternal support grant. We know that there is no evidence to show that that the child support grant, for example, incentivizes pregnancy. In fact, fertility rates have gone down since the child support grant was introduced. But there's still this misconception that that's a maternal support grant or grants will incentivize pregnancy. So, and this is, from stakeholders that you wouldn't, think would still hold that belief. So even if there is evidence, there isn't always alignment on evidence. So, but that's not true with everything. Also, I think with the evidence part, it's important to, I mentioned previously, there's global evidence and local evidence. So, and also you need to be sure that it's contextual. So it can be, having robust discussions around evidence and the types of evidence and what also needs maybe additional evidence to be brought in. So that can be a barrier. Competing incentives. That can definitely be true, especially if you work at the intersection of government and civil society and also the private sector. People have different, they might have similar goals, but they have different interests. And so you need to be, careful and aware of those competing incentives. And sometimes you also don't understand where you're in the room, what's at play behind the scenes. So there might be some political pressure or sometimes there's a trade. So it's not that, for example, let's have the example of the maternal support grant again. The maternal support grant is often put against something like the universal basic income grant, and it's pitted against each other. So people will say, if we have the one, we can't have the other, and that's not the argument that you want to make. But there are certain people that are really behind the universal basic income grants, and then others behind the maternal support grant. So it's like where that sort of behind the scenes conversations go on that you're not always privy to in the room if you bring along all the stakeholders. And then political feasibility. Yes, sometimes, because as I said, things cost money, and sometimes there's not funds provided, so you need to treasury. So if you say there needs to be leadership, and if there's not leadership, then money won't be won't be released. But also, if intervention costs, if it seems to cost too much money, and there's another intervention that might seem like it costs less money, then somebody might go to, they will say, okay, but we're going to do that intervention, or rather back that and not the other one. So it's there are multiple barriers, and it's not always the one or the other. Sometimes it's all three of them.
Thank you, Liezel. I think your examples have also been fantastic, and it just encapsulates all of that really, really well. Pins also just wanted to make a comment quickly.
Oh, just to remind everyone to please scan the QR code if you have any questions for our two panelists. It's anonymous. We just want excited questions from you, so please feel free to do that, and we will upload them and just make sure we stop at time. Maybe I'll take over for the next question. But yes, thank you so much, Liezel. I think very important, as you said, like it's often multifaceted and often like quite layered in terms of the barriers. And I think it does require quite a lot of resilience and zeal for whatever you're trying to push across. There's a question for Dr. Lethu, which says, to what extent is trust something that can be built through communication alone versus something that depends on broader health system performance and lived experience?
I mean, trust is not communication alone, right? You can't shout evidence at someone and hope that they're going to follow it and make decisions based on that. You need to win people over. Like Liezel says, there are relationships that need to be formed, right? So when it comes to broader public health communications, if we look at South Africa, I think what's important is looking at how well is our health system performing? Why do people not trust our system? What do we need to put in place? Oh, can you hear me? I think I just disconnected there for a second. Can you hear me?
Yes, we can hear you.
Oh, okay, perfect. So I think what's important here is being able to acknowledge people's lived experiences. I think maybe it goes back to the question that we spoke about a bit earlier in terms of there are times or moments when people might not trust the system or might not trust a new intervention. If we look at a relevant example, look at lenacapavir. We have this amazing technology that can help us prevent HIV and possibly end the AIDS epidemic. But there are already trust issues that we see coming up, right? And what this relates to just the pandemic that we just saw now with COVID-19, where there was a lot of misinformation around the COVID vaccine and what it offers or what might be in the vaccine. So people had a lot of questions around that. And now I'm seeing this creep up again when it comes to taking the PrEP for HIV prevention as well. Sorry, my phone keeps ringing and I'm trying to stop it. Cool. So I think it goes beyond that in terms of if we're going to look at communications need to be responsive. Yes, now with lenacapavir, the minister has already started talking to communities before the misinformation forms, before people start forming other opinions. Let the health department that we all respect, that we acknowledge and receive our care from, be able to be the one that comes forward and speaks, right? When it comes to the endocrine disrupting chemicals that were found in women's bodies. So being responsive in issues that people care about and that are out there, I think it is important. But now, the risk there is coming forward, not having enough information, and that usually takes time. So that's the thing with science, that sometimes we can't always respond at the pace that communities need, and we need to be able to navigate that. And without compromising evidence and compromising and putting ourselves in a place where we'll need to retract statements and go back to things that, that creates confusion and might create a bit of mistrust in the system. So I'll pause there now. Thank you.
Thanks, Dr. Lethu. Thank you so much. I think that's important. When we first hear of people's distrust to ask why. And I think sometimes we can be tempted to become paternalistic and, you know, want to reassure them and actually not acknowledge or listen to their lived experience. And I think it's really important to do that, to move from a more paternalistic way of communicating with patients to actually partnering with them, hearing what they have to say, and being responsive, whilst obviously taking the necessary time to accrue evidence so that what information we share with them is actually true. So thank you so much for that. Meeks, you can take the next one.
Thank you, Pins. I think maybe we could have both speakers answer to this one. How can global health better integrate locally generated knowledge without compromising comparability and scientific standards? I know, Dr. Lethu, you started leading on to this one, but just maybe if we could get a short response from both of our speakers. Thank you.
Yeah, this is I'm definitely not the experts on this, but maybe an example would be, you know, around MMS, which I just spoke about. So and there will be locally generated knowledge now. So that is the research that we are that Hold My Hand and DGMT is partnering with WITS RHI with, specifically around local research about MMS feasibility and acceptability. And what is being done is, you know, we're using the UniMap product. So it's a product that's been approved by UNICEF. So it's a pure micronutrient with 15 vitamins and minerals, and it's a specific formulation. And that's, you know, that means that we are, you know, using a similar product to global standards, and then the evidence that we generate, you know, that can then also become part of the body of knowledge that's then shared, you know, via your journals, etc. So I think it's important that if we do research, that we properly document those, that we make sure that we are, you know, abiding by, you know, best practices, and that we also then share that research to be able to, you know, become part of the global body of evidence, so that can be, you know, later used and cited, you know, with comparability not being compromised. And there will always, like in all studies, there will always be variability, there will always be confounders. So it's not, yeah, it doesn't disqualify you if there are, you know, if there are some things that are variable or different in different contexts, because, you know, we will have different contexts and implementation in, for example, if you compare South Africa to the Philippines, you know, where the product is used, the adherence, you know, or you know, feasibility of some things might look different there. So yeah, I would say just make sure that, you know, that's that we are using global best practices, and that we share the information so that it can be absorbed into the global body of evidence.
Yeah, I mean, Liezel, I think you've captured that so well. What I'll just add is just we also need to realize how important local research is, and research by locals on locals. I think there's a very different perspective that we get there, and we need to be able to acknowledge that research, respect it, and be able to implement it, obviously, as you know, as whatever the evidence tells us works and what doesn't work. Yeah.
Thank you both very, very much. I think, it's definitely a difficult question that our audience has asked both of you, but I think you've pretty much nailed it. It's being able to take accountability, to take the steps forward, and just, again, evidence-based. So we can just move on to this next question. Liezel, how do you ensure that less powerful voices in the room are not overshadowed by institutional stakeholders?
You get a really good facilitator. And it's really like, if you work in groups, if there's coalitions that you form or you have meetings, it's really important that there is a clear agenda, but that also that you have a facilitator that is skilled in not having the loudest voice or the most influential voice dominate. But then also, if they are if you do think they are going to be power imbalances, it's sometimes good to have separate meetings, and then there can be sort of mediating questions in another meeting. For example, if you have certain senior officials in rooms with sort of more junior people, you're less likely to sort of get sort of honest responses. Also, if you have people that sort of hold more power in one aspect, so maybe they bring a lot of resources, and you have somebody from an NGO in the room, but they rely on this organization for some of their resources, then the civil society organization or NGO might not be willing to speak up. So I think it's about thinking about what you're discussing, and what your result will what your outcomes are, and then really I think carefully thinking about sort of the people in the room. Are there power imbalances? How will you manage that, and sort of really prepare for that, prepare the facilitator for that. And if it's going to be that it sort of skews the outcome, then you can rather have sort of separate meetings or breakout rooms, or breakout sessions. That's also often a technique. So to really make sure that different voices get heard in a breakout room, when you have like a sort of a separate sort of facilitator for specific breakout session, and they sort of write up those responses, and you make sure that you sort of separate some of the people that might be influenced by others. So it takes some planning and some skill, because yes, otherwise it is easy that the most powerful voice, or the person that sort of has the most influence can dominate that conversation.
Thank you, Liezel. I think that's such a great way to explain it. I mean, facilitators can only mitigate so much in those conversations. So knowing what you're there to discuss, what outcomes you're preparing for, and knowing that target population and your stakeholders definitely can define how we go about it. Fantastic answer. So just our last question to both of our speakers. What does it actually take for good evidence to translate into real-world behavior or policy change? And where does that process most often break down?
I'll say when it comes to policy change, you need political will. I think that is very important. Liezel touched on it earlier. If you don't have political will, it's very, very difficult. And obviously that needs to be supported by evidence and a lot of stakeholders who are advocates for this and who can work together to put that policy together to advocate for it. But political will, I would say, is one of the most important ones when it comes to policy change. When it comes to real behavior change, so what does it actually take for good evidence to translate into real world behavior change? I think what really matters, so this is something that we used to learn about in health promotion, is which we spoke about earlier, is the environment needs to allow for the person to be able to make certain decisions that allow for their behavior to change and for their health outcomes to improve. So the environment matters. A person needs to have enough knowledge, so they need to have the information, and they need to have the willingness to actually make that change. And people need to have access to resources, whether that's healthcare, whether that's education, which also affects health outcomes, whether that's nutrition, whether that's employment as well. We know South Africa has a huge unemployment crisis, especially when it comes to the youth. So when people are unemployed, that's synonymous with poverty, that's synonymous with poor health. So it's very difficult in those situations to be able to see behavior change in a way that we would hope would lead to health better or improved health outcomes. So I think all of those are more like the social determinants of health that we need to look at to result in better health outcomes and real world behavior change.
Yeah, I totally agree about the political will. But to an extent, sometimes that can also be created if there's a groundswell, if there's a great public demand, if people make their voices heard. Lethu spoke earlier about the treatment action campaign and sort of the amazing work that sort of happened there, and sort of really the advocacy work. And I think so. If you communicate, then and to I think education and information needs to go in parallel with the policy processes, because I think you need to make sure that sort of those two collide at the right spot. Like, at the point where there's political will, the public must be, already sensitized to then support that. I think that's ideal if it can happen like that. So, for example, one of the things we are also really strongly pushing for is a basket of more affordable food, right? And so that is also very, very sensitive to to communicate to vulnerable communities that are already sort of hungry and food poor, because it's an ethical, question of, how do you speak about, food and, food poverty in a community, and you're asking them to sort of share their stories and share their experiences, because you want them to, be part of this advocacy to help reduce the prices of affordable of a basket of foods. So, but that's important, because people need to make their voices also heard, so that politicians can see this is an important issue for people. So we should take this more seriously. Yeah. But then the other thing also, like behavior change, as you said, like systems need to change. Like, we can't tell people, and I'm speaking about nutrition again, you have to sort of eat these healthy foods, but decisions are made with money. If you can only afford, a certain type of food, then, you're not going to, be able to buy to have a healthy, balanced diet. But I don't want to end on that sort of gloomy note, because I think it is, we have seen that, public voices and public communication, like the campaign that Lethu worked on, Karedi, that really had sort of, great impacts to, help, youth get, just more information. I think before, youth was more COVID-led. So, it's really possible to have communication also drive behavior. But COVID had political will. But we shouldn't say just because there's not political will, nothing's going to happen. We can create that. We can help create that through the evidence and through the communication and through sort of that demand generation. And that's why it's important to educate people and get a clear call to action. If you want to do that, you need to ask people, or really sort of be clear on what you want people to do. Is it sign a petition? Is it what do you want them to do with the information? So yeah, I'll stop there.
Thank you so much, Dr. Lethu and Liezel. That was a great way to close off our session. I think, Dr. Lethu, you just highlighted the upstream and downstream nature of it all, right from political will to making sure people are in environments that are actually conducive to make that change that we advise, but also that we can, as the public, push for that political will to be generated. I think that was a great point, Liezel. And I think for me, it just spoke to me both in my healthcare professional capacity, how can I inform patients? How can I be an advocate for patients? But even in my personal capacity, when I see that there are there is a need to support certain things. Maybe I don't always have to lead it and I don't always have to be at the forefront, but maybe I can just put my signature on a petition. Maybe I can attend a campaign initiative. What can I even do in my personal capacity? So I think that's a great call for all of us and a great way for us to end the session. So thank you both so much, and I'll hand over to Meeks to close us off.
I think Pins just nailed it in that comment as well. So as the SAMTRA committee, we would like to thank our incredible speakers for their time and everyone that was able to attend. I'm very lucky to have Pandile as my co-host, and we hope to see everybody in future for other CPD events. They'll be coming soon, and more webinars and beautiful discussions as healthcare professionals. Thank you, everyone. Have a wonderful evening further.
Thank you for having us. Cheers.
Thank you. It was great.
Thank you.
Bye.